Um, so Brad, go ahead if you could just give me a quick introduction of yourself, where you've been and what you're doing right now.
Okay. My name is Brad Sage. I am a 2005 graduate of Old Dominion University, where I received my master's in education, concentration in athletic training. I should say I did my undergraduate at Mercyhurst University in Erie, PA. Graduated in 2003. After leaving Old Dominion University, I returned to Mercyhurst, where I served as an assistant athletic trainer, a full-time lecturer, and the clinical coordinator for 9 years. In the fall of 2014, I took a position as a clinical coordinator at Indiana University in Bloomington, Indiana, where I currently serve, as I said, the clinical coordinator. I no longer have patient care responsibilities, but I'm also a full-time lecturer here as well.
So, so you don't really supervise students in the athletic training room, but you teach an entire class now. So, or a
Uh,
couple different
yeah,
classes.
yes and no. One of the great things about my position here is that I have no research responsibilities or service responsibilities as per my contract. That doesn't mean I don't engage in those activities, but it means that I have, in theory, more free time to go out to the clinical sites and visit more frequently. So, in comparison to, I think, a lot of other clinical coordinators, I have a lot more time to go and spend in the clinic. So I'm in the clinic at least 3 to 4 days a week. So I have my goal is to see every athletic training student at least once a week in their clinical setting. So I wouldn't say I have no exposure with the students in the clinical setting. It's certainly not as much as it was when I was an actual preceptor, but I'm fortunate enough to be able to at least have some contact with them each week.
All right, cool. So, um, you know, one thing is, how do you describe this position? Is it like, is this where you plan on, what is your ultimate goal as an athletic trainer? Do you want to be well, no, do you want to be like a program director? Do you want to stay as a
Yeah.
clinical coordinator? Where do you want to go
Uh,
next?
If you asked me last year, I think
Mm-hmm.
I would have said I would eventually like to have been a program director for an undergraduate program because I enjoy the undergraduates tremendously, and I enjoy their growth from the time they come in as a freshman, applying to the program, starting as sophomores, and graduating and helping them on their professional way. But now with the change to the entry level master's program, I'm not sure if I want to or am in position to be a program director of an entry level master's program. I have, had some conversations to that effect, but to be honest with you, I'm quite happy in the clinical coordinating role because I've seen the value of it, and I think especially as we switch to entry level master's programs, I think that the position of the clinical coordinator is extremely valuable as we look to coordinate people who will be graduating not only with a professional certification, but a master's degree. So I think that the role of the clinical coordinator in bridging the education to clinical application gap is going to be probably even more important moving forward. So I'm content where I am,
Mm-hmm.
but that doesn't mean I'm never looking for ways to push my own professional growth.
All right. All right. So yeah, you would say you're pretty excited about your current job. Just a high level of excitement.
Yes, very much so, and I think that I think it's all because of the institution and the people that I currently work with.
Mm-hmm.
So, and I think the unique thing about athletic training is depending upon your setting, each job and each role can take on a different meaning. At Mercyhurst being a small Division II school, I was the clinical coordinator, but that was really probably less than 20% of what I actually did. And that was primarily because I taught too many classes, I think, as many teachers would tell you. I was overloaded credit wise. I had patient care responsibilities. I was still working as an athletic trainer. So the clinical coordinating often took a second or third seat most days. Here, I view it as my primary responsibility. So when I come into the office every day, that is the first thing on my mind is making sure the students are, set clinically. I've resolved any issues that may have come up, and I'm always available to preceptors and students to handle the clinical education side of things. So, yeah, I'm very excited about this position because I think it's given me the freedom to do the job of clinical coordinating the way it probably should be done, and I've really enjoyed that aspect of it.
All right. Okay. We covered a couple of these questions earlier. Um, so I know you said you're not a preceptor right
Mhm.
now, but what were in the past? What were some of the positives for you being a preceptor?
Well, for me specifically, being a classroom instructor and a clinical preceptor at the same time, clearly that gap of having the same students in the classroom and then in the clinical setting was ideal. You know, to be able to lecture on something in the morning or throughout a semester, and then be able to see it clinically on a real patient and have the students, kind of back up our theory. In other words, of what we said on real patients. But on that same note, it's interesting to see things that you say in theory will work and then to try them and have them work. But it's also great to have a best plan of, so to speak, of what you should do textbook wise, then also see that fail miserably in the clinical setting because the patient values in the setting don't allow you to do what the textbook says you should do.
Yeah.
So I think that aspect I really enjoyed of taking what the literature is saying, what best practice is saying, and then actually applying it to a setting to see if it is the best for that particular setting.
Yeah.
So that was phenomenal. I also think that as a clinical coordinator, being involved with the athletic staff day to day and understanding their strengths, understanding their weaknesses, and understanding the struggles that they encounter in terms of administration, coaches, the setting, helped better place students and help better facilitate the clinical education because I had an acute understanding of what was happening clinically. Where here, I'm not in athletics every day. So I really don't know acutely what is happening over in athletics. Now, I talk to them every day and I try to get a picture, but it's one thing to experience it and be a staff member versus being kind of an outsider and hearing what's going on. So I think that was extremely valuable part of things as well. So, I think that aspect of it was great, even though it created some role strain at times, being on either side of the coin. I think it was good in that aspect that the kids kind of saw you on either side.
Yeah. And that's one thing that I've kind of started just in, is it, it's maybe just finishing, because last week is half a week, so the second week of the semester, I'm working as a TA with the rehab class with the juniors, and we have 3 juniors at Terre Haute South, along with a senior and soon to be, like, we have a sophomore and we'll have another one. But to just see what's going on in the rehab class with the juniors and having my own junior and having a bunch of them in working with all them and being able to see what will happen, because it's only been two classes, but so to have that will be nice, because I remember not so much, well, this past place I was, they came from about 45 minutes away, and I had no interaction with the faculty at all. So I had no idea what they were teaching them, what I should be teaching. So to be able to have that double exposure will be, I can see why it helped you and why it will help me so much. So
Absolutely.
it's one of the really nice parts about having a program right on campus, as opposed to some places that they need clinical sites. And I know Indiana State has a lot of students, so they send them out a little bit of ways. But from what I've come to understand is that there's a little bit better communication too. So they all have a good idea, whereas where I was before, I was never really getting, I had really no idea, no communication whatsoever, other than with the students. So that one was a little tough. So,
Good.
um, so, oof. So we talked about we. I don't think we talked about actually mentoring. I don't, mentoring athletic training students. Um, this would be, I guess a better question more so. I mean, now I'm sure you do, but back again when you were practicing clinically, just acting as a mentor and more, not more, but along the lines of being an athletic trainer, but also with knowing how to work with the student athletes and just not community, connecting with them on a level to show them that, yeah, I'm a person too, or like, hey, the undergrad students, like, yeah, I'm a student. We're going through the same thing. So,
Mhm.
um, so what ways were you able to help mentor your students with something like that?
Well, I think mentorship takes on a lot of different roles, and I think it's something I'm very interested in because athletic training is unique with mentorship because we spend so much time with our students, both in the classroom and in the clinical setting. Especially because the students tend to get into these cohorts where they're always in the same class at the same time. So in the classroom, you tend to have the same group on multiple occasions. Then when you get into the clinical setting, as you referenced, I think they see you in a different light. They see you as a clinician, and sometimes they see you as a person, because as a athletic trainer, you have to deal with a range of emotions. Whether a coach is upset, an administrator is upset, athletes going through a range of emotions. That dictates on how you are going to react. And it's very easy in a classroom to always be professional and to hold your composure. But when you're on a sideline and someone is injured and a coach is upset and players are upset, sometimes your own emotions can come up and down. And I think that that's something that, students kind of see in a different light. So mentorship, though, in both of those situations is really always been to me about modeling the way and really kind of showing the students how this profession probably should be done, but also that it's not perfect. And I do think that the students will uh, kind of appreciate in many ways the imperfections as much as they do the things that you do really well. And I think that's an important part of it too. Um, and I think that mentorship at its core, when a student is looking to you as a mentor, you have to ask, why are they coming to you for mentorship and what do you have to offer them? And oftentimes it's because you are traveling a path or have traveled a path that they also wish to go. And I think that the real issue with mentorship is too often students will come in and say, well, I want your job. I want to be just like you. I want to do exactly what you did. And that's not always the best situation. And I've always taken a philosophy that I want to create a student in their own image and make them and facilitate them to discover who they are going to be in this profession. And, for example, I never thought as an undergrad I would end up as an educator in a professional program and teaching as much as I have. I always viewed myself as a clinical person, and it was only through my own mentors that I was able to self-discover what my true passion was in terms of education and this side of things. So I think I've always kind of taken that to heart that students go through a long journey of self-discovery, and as a mentor, I'm not going to say go do this because this is what worked for me and this is what didn't work for me. So for example, I have many students who have pursued internships in professional sports and very high level athletics, and I never did. I never followed that path, and I never worked in NFL training camp. I never pursued that myself. But I think that I've been able to be a solid mentor in facilitating those students to pursue their own goals and their own dreams that way. And that's just one example of many. But I think that the mentorship again is really comes down to the fundamental skills of being a professional and really kind of being a person. And that's, communication, it's listening, it's understanding, and trying to facilitate the growth of the individual student. And whether that's clinically, whether that's educationally or through research, in any of those ways, I think the fundamental principles of mentorship are always important there.
Yeah. I tell them, my students, a lot is that the thing that we do as athletic trainers the most is probably just talk to people. Like after
Absolutely.
the most, like
Absolutely.
outside of, yeah, we'll do rehab and stuff, but I feel like especially not so much. Granted, I've only been here a little bit, but in past places, the thing I always did the most was email, call people, talk to people, because it's always about this or that or something where people are asking me questions and I have to answer it, and or
Correct.
athletes need to know this, and a lot of times I'll ask them, "Hey, did we do this or did this happen?" They'll go, "Yeah, don't you remember?" I'm like, "No, you have no idea how many people I talk to in a day." So once in a while, you all blend together. So, and something like you mentioned failure and the
Hmm.
clinical aspect, and we had just talked about failure in another class. And I remember when I was an undergrad and I was struggling to get out of the program just because, well, you're a senior, you're trying to get done, and I had a class that was, I think it was exercise physiology, not my strongest one, but I was worrying about failing, and I'm like, oh, so that fear of failure to motivate you to get out. And it wasn't until I was a graduate assistant the first time, and I've realized that I could fail. Like, I mean, nobody was ever gonna die, but it could be something like small. Like I could, like you said, you'd go to do something, the best laid plans, and just fall apart. And then I realized, well, when I would fail, that was when I would actually learn the most. And I always tell my students now, clinically, I'm like, never be afraid of doing something wrong, because that's when you're going to learn something. If you
Hmm.
do something right, what do you actually learn from that? Nothing. You
Right.
just move on and you probably forget. If you
Right.
fail, you have to go back and you do it again and you learn from those mistakes. So
Right.
I think that's something that preceptors learn from their experiences, and that's something that preceptors have to figure out almost to explain, because it's so hard. Kids are like, I don't want to fail, but it's like, no,
Yeah.
it's not like you're gonna fail the class. It's just it's a little one. It's not that big of a deal to an
Right.
extent. So
Right.
um, that's something that I learned just recently, and I think that is something good for any mentor to really know.
Hmm.
So, and that's something that I've kind of remembered that I like to do too, is working with students and everything like
Absolutely.
that. Um, so last couple things real fast. What excites you about the what is like recently? What is now starting to really excite you about athletic training? And so, like we know from the beginning, like we've talked, like how we've gotten to this point, but now, right now, what is making you the most excited about being an athletic trainer?
Well, I think it's I think when you talk about excitement, I think excitement and fear go hand in hand.
Exactly.
Because I think the things that are scary at the moment are also the most exciting because in the fear of things, there's also the potential for where this profession is headed. So there's a few things actually. I know there's a huge push, especially in upper level athletics, to start billing for services, and I think that administrations around the country are starting to see the potential revenue stream that athletic trainers can bring in. And I think that they're starting to acknowledge our skill set and how much monetary value we can bring. So here is the scary part because when we do that, how is that going to change the fundamental nature of athletic training? Because we have this carte blanche type of model of healthcare because we don't bill for services, so we do whatever and wherever we want, and we have that luxury. And that separates us from physical therapists and occupational therapists and chiropractors because we can do 14 ultrasounds a day on the same ankle if we want to. I'm not
Yeah.
saying that's best practice, but there's nothing stopping us or precluding us from doing that if we feel that that's right. So that's scary because it's going to change how we operate. It's also exciting because I think that's probably one of the key ways that we're going to increase our salaries because now we can say this is what we do, this is our skill set, this is what we can bring to the table for a clinic, a hospital, an athletics department, and this is what we should make and we should see the repercussions of that monetarily. So that's exciting. The entry level master's degree switch is something I have come full swing on recently over the course of the last couple of years. I think that there's value at the undergraduate level in producing athletic trainers with a degree, and I currently think that the current set of competencies and standards and guidelines are sufficient in theory to prepare an athletic trainer to graduate after 4 years and become a certified athletic trainer and be competent. However, I am concerned about clinical incompetence because it might be too much, and I think that's a concern. But really, after the educators conference in Dallas and listening to a lot of people in higher education speak to where health professions are and where athletic training is, to take a quote from Dave Perrin from that conference, the train has left the station in terms of healthcare and where it's going. And not only are we behind, we're really trying to catch that train. And it's my view has shifted because I've taken a view of not really looking at athletic training where it is now, but where it's going to be 20 years from now. And I think if we don't make this switch now as we have, we will really be behind 20 years from now. So I think that's exciting. And again, there's so many growing pains that we're going to have to go through that process to get everybody on board and to get it to where we need to be. But I'm excited because I do agree it's best for the profession. It's going to make us more qualified. It could hopefully increase salaries and increase the maturity of an athletic training student graduating. So I think that's very exciting. Now that there's plenty of issues to work out with that, and that makes it scary. But at the same time, the potential for that move is very significant to the profession. So I'm excited about that as well. So, I think those are kind of the two things that I look at in athletic training that are going to be very different, moving forward, that we're going to have to embrace and we're going to have to deal with.
Yeah. And so, does that ever come up with your students? Do you talk to them about that at all? Does in class, or do you model that to them at all, or show them, or have you guys has that been a big topic of conversation?
Yeah, especially because we obviously have the undergrad program and the grad program here, so the grads have gotten more of the lecture series type of stuff, especially when the white paper came out. And we've had people like John Parsons come in and speak. Joanne Klossner, who had my position before, who's on the committee for education, she's came in and spoke. So we've had some very well connected people at the table for these discussions come in and share that with the grads moving forward. But really, I think to the students currently, their question is, okay, how does this affect me? And it doesn't right now.
Yeah.
Our undergraduates graduating, they can get certified and work if they want to still. And they can for a few more years, and they still have the option of getting a professional master's degree if they wish. Our grads are going to have a master's degree, so it doesn't affect them. They're going to certainly, I think they should voice their concerns and have an opinion, but it does not affect them directly. And I think that when you look at students at that age, including the grads from 18 to 25 or so, I think they're more concerned about finishing school, finding a job, planning their futures rather than.
Your lights
Sorry
just
about
went
that.
off.
Sorry about that.
I haven't moved in a while.
I think they're more concerned about their own futures at this point than looking at the profession as a whole. But we do keep them appraised of those situations. Now, in terms of the, billing and third-party reimbursement and all that kind of stuff, yeah, we do. We address that. We bring it in. We talk about that value. I used to do a small project in my administration and management class where they would have to write down all their treatments, find the CPT codes, and tally up their own bill for services for an entire semester. And they were shocked that they could have made $35,000 in one semester just billing for what they did as a student. So yeah, we make them aware of the situation. And the hard part, which has always been a hard part of athletic training, is saying, you show them that and you say, this is our value and this is what we do compared to other healthcare professionals, which is similar, sometimes identical, sometimes more intensive. And our salaries are much less than those people, and that's a hard sell to the students. But then again, we have to make that information available and show them what the lay of the land is, so to speak.
Hmm.
So they can be the ones making positive changes moving forward. And I think we're starting to see that.
All right, awesome. Well, all right, well, thank you very much, and I'll
You're
talk to you
welcome.
later.
All right.
Thanks.